Good afternoon, everyone, and welcome to our show this afternoon. Can everyone hear me?
Yes, we can hear
Yes,
you very well.
Okay. Patience, can you hear me?
I can hear you. I can hear you very well.
Oh, all right. Thank you so much. Today, our guest is Dr. Enku Demssie from Ethiopia, a medical doctor who has mentored over 300 frontline healthcare professionals in HIV and TB treatment. Dr. Enku is passionate about data management, monitoring, and evaluation, and has also worked in various USAID projects. So, Dr. Enku is going to take us through data and decision making, healthcare and treatment, as well as empowering African communities. Dr. Enku, welcome.
thank you so much. Thank you, everyone, and thank you for having me.
All right. So, Dr. Enku, can you please take us through what healthcare management is and how do we infuse it with technology?
Okay, thank you. But before we start our discussion, I have a disclaimer to mention, if you
Right.
allow me. Okay,
Please go
thank
ahead.
you. So, the views I'm going to express today during our discussion is solely my personal views and perspective. So, I want to emphasize that I'm not here representing any organization and institution. So, you can
Thank you so
continue.
much.
Very well.
Thank you.
All right. You can proceed.
Okay, let's start from healthcare. Healthcare. I can start from my country's context. As you have mentioned, I'm from Ethiopia, which is a country in the Horn of Africa. There are like 120 million population, over 120 million population, and the health care system is structured in three tiers. There is a primary healthcare system, which primarily includes the primary hospitals, the health posts, and health centers. And there is a secondary healthcare system, which mainly composed of general hospitals, and the tertiary one, which composed of referral and teaching hospitals. So I have been through this system since medical school. And after I graduated from the medical school, I had the opportunity to serve in the primary and the tertiary structures. So I have been working in different service delivery units, but today we are going to emphasize on, I think, the mentorship, which is the HIV care and treatment one. So, uh, should I proceed with that journey or?
Yes, please, ma'am.
Want to know about that, you can share your journey of becoming an HIV care and treatment mentor with us.
So I was always interested in infectious disease, as we all know that our continent accounts for the significant proportion of the infectious disease global burden. So I was always passionate about infectious disease, particularly HIV, and there were moments which make me more interested in the HIV care and treatment aspect. So when I was an intern, it's like HIV care and treatment in the medical school is like a 2 weeks attachment. We don't usually get a broad and extensive training on HIV. So there were moments which make me more interested in this area. We used to have allocated beds during our attachment in the internal medicine department. So one day, this patient who is very young in his 20s was admitted under my care in the internal medicine. So he was very critical. I still remember his condition, and his family was in despair. But despite the despair and his critical condition, I was very determined to provide him with the best care he could get. And I was immersed in researching, pouring the WHO guidelines and also the national guidelines so that he could get everything that could help for his condition. So it was a very long journey. It was very tough, and he had been through a lot. And in the process, I was always there as his primary healthcare provider. So it was a long journey, but after almost 2 months, he was discharged with good health. So that moment, I still remember the warmth I felt in my heart. So since then, I was very interested. We continued to be family with this patient. I had the privilege of attending his wedding and other milestones. So it was very happy moment. So since then, I was very interested in the HIV care and treatment aspect. And after I graduated, I was always trying to join that service delivery unit. So, but I didn't have the formal practice, the formal training for HIV care and treatment. As I have mentioned in med school, it is just a 2 weeks attachment. So we don't usually go deeper in the HIV care and treatment, but there are so many things we should know about that. So I tried to get the trainings, and I was fortunate. So I got the training for both ship and the clinic meeting as the clinical mentorship coordinator. So different healthcare workers from different health facilities from different tier. As I have mentioned, there are different tiers: primary, secondary, and tertiary. So initially I was in the tertiary tier, so I was mentoring other healthcare professionals from both tiers. So it was a very good experience. So mentorship, unlike that of supervision, it's like personal relation and professional relation focused. It's about creating a relationship that will foster personal and professional development. There is no judgment in mentoring. So I was trying to transfer knowledge to healthcare workers, which that are working in as frontline healthcare workers in the HIV care and treatment unit, and it was a very good experience. So there were challenges, of course, but the successes are more warming than the challenges. So I have trained over 300 healthcare professionals over this area. Yeah.
Wow. From what I picked up as you introduced how you started your journey, you were motivated by love from that
Yeah.
one particular patient that you
Yeah.
felt you should. Is it of importance to have such qualities in this profession, in the healthcare profession?
Yes, it's very important. Mentorship is very important to improve the healthcare delivery, the quality of the healthcare delivery, which in turn will improve the outcome of the patient and the care provided to that patient. It also helps in organizational success because the employees of that organization, so particularly we are talking about healthcare delivery. So for that healthcare delivering facility, the employees or the healthcare professionals are key for its success. So the capacity of the employees matters a lot. So it also plays a crucial role in the organizational success, professional development, even for personal development. There are many things we learn from mentorship. It's a bidirectional learning activity, actually. As a mentor, I was always learning from my mentees. I was not only assisting them to learn something, but I was learning from them. I have learned a lot from them. And also, I was trying to transfer a knowledge. So, mentorship is very important and crucial for delivering or improving quality healthcare and to improve patient outcomes and also for the organizational success. it also creates job satisfaction, which is a very good thing. So it's very important.
Mm, really, really important. So, Doctor, Africa as a continent has the highest HIV and TB prevalence. What could be the result of this? Are there any gaps that you can point that you think they are not met?
Can you please repeat the last one, the last part?
Can identify some gaps that you say this has influenced to the highest HIV and TB prevalence in Africa? Are there some things that we are not doing that other countries are doing? What is really the problem?
Oh, okay. You are right. We account for the highest burden of the global infectious disease overall, but particularly for the HIV and TB, it's always true. So what we are not doing, it's a multifactorial actually. We cannot mention specific reasons for this, but multifactorial. But I believe the community should be enforced. My work has been mainly focused in Ethiopia, but I believe that the community should be enforced and strategies which are proven to be effective in other parts of Africa and different parts of Africa should be implemented and adopted in other parts of Africa. And we should also collaborate. Collaboration is a very good thing. Experience sharing, collaboration, best experience sharing is very crucial, I believe. The other is we should always be able to adopt innovative approach. For instance, for particular to the HIV case, there are different innovative healthcare delivery models. It can be the differentiated service delivery model, which includes the CAG, which is led by health extension workers, community ART delivery, or it can be PCAD, it can be peer-led ART delivery. The patient doesn't have to necessarily come to the health facilities, but these community health workers or the peers can deliver the ART. So we can achieve a better adherence and retention. So such strategies, we should be open to adopt such new strategies. The other is tech innovations. We are hearing now here and there that there are many African-led innovations, and I was hearing like drone delivery system, the inventory system. So such strategies are also very important. The other is the service delivery should be decentralized. Centralizing the service delivery is no good. So decentralizing the care delivery will be very helpful. So how could we do that? In my country, we have an experience of the health extension program, which is a very good program which was initiated some years back. So it is led by the health extension workers and they provide door-to-door health care delivery. So this is very important. And I heard there are also other African countries that are implementing such a strategy like Malawi and South Africa. So such strategies are very important. The other key thing is the community itself should be involved. Community engagement is crucial, so we should also focus on that. I think by doing these things and other innovative approaches, we can improve this burden. Yeah, I believe.
Indeed, you've been spot on, Doctor, and these are really practical measures to take into consideration. Talking about the strategies, do you think technology can be one of the strategies that we can use in combating HIV and TB prevalence in Africa?
Yes, of course. The time is now there are very new initiatives, technologies, not only in the healthcare, but in every aspect. But when we see the healthcare, there is telemedicine, there are digital health platforms, there are mobile applications, mobile health applications, and these are providing Africa a better healthcare access. So this is one thing. The other is this is also the time for artificial intelligence. Now we are hearing that there are robotic surgeries which haven't been done before, and advanced robotic surgeries are being performed in the western part. So that time is coming, even for our continent. It will be here soon. So artificial intelligence is also, we should leverage that opportunity. It's very helpful. Uh, the other is EMR, electronic medical records, for example. In my country, the recording system, even now, it is like paper based. So our database is not very complete. So the data analysis and the data management system is not that strong. So evidence base is compromised in such scenarios. So AMR, widespreading AMR is very crucial, which is one part of technology. So through widespreading this AMR, networking AMR, a patient can go anywhere, and a healthcare professional could access his or her history from the remote area, which is a very good thing. So technology plays a crucial role in the healthcare, I believe.
It really does. But looking at our African society, cultural practices, how effective can technology really be? Like you mentioned that in, let's say, overseas countries, robot seems to be working effectively. But can we really incorporate them in Africa? What's the what's the acceptance of such in African cultural practices?
You are right. It seems far, far away for today, but we can think of other technologies like phone, car. They were invented in the Western, and I don't think that it took so long to reach Africa. So this, the robotic surgeries and other advanced artificial intelligence technologies might seem like far away for now, but after a few years, it's going to be very routine. But for now, if you are talking about the current situation, what I have mentioned before, the telemedicine, the EMR, the digital healthcare platforms, and other applications can be in use. So the African-led innovations like the drone delivery is a very good example. Now it's being implemented. I was reading an article about a drone delivery system which was being applied in some part of Africa, which is a very good thing. The other is the inventory management. It's also very applicable even in the present day. So it will be like that. Yeah.
So, in short, even though it looks far-fetched, but we should hope that Africa will get there.
Yes, definitely. We will get there soon enough.
Uh, you keep making examples from your country, Ethiopia, and I want to draw those examples, relating them to my country, Lesotho, as well. Um, I'm not sure if we can really make an assumption that somehow familiar in African countries. I don't know, patience.
Yeah.
What can you say about healthcare in Nigeria based on what doctor is saying? Can you relate?
Yes, definitely we can relate. Most of the things Dr. Enku has been telling us about, although I'm not in the medical field, I don't belong to the medical profession, but I do see what they do. I observe their activities, and I can only say in all sincerity that HIV care and treatment in Nigeria is a work in progress, just as it is in other countries of Africa. We are still taking steps, and some organizations too. They are taking steps to see how everyone can be included. Those who are affected, people living with HIV/AIDS, have been carried along. We also have some doctors with a heart of gold, just like Dr. Enku, who treat with love and also try to mentor others along this field. They do that a lot through organizations. We have some non-governmental organizations. So whenever it comes to HIV/AIDS treatment or care, it's often affiliated more with these organizations. That's what I've come to observe. And very, on very, very few or rare occasions, do I hear anything that has to do with HIV care coming from maybe some of these governmental agencies or policymakers. Whenever I listen to the news and things like that, whenever you hear HIV, your mind will always go to NGOs. NGOs are always taking the lead. And some doctors who have a heart of gold, like I said, they partner with them, they collaborate with other doctors across the country, as well as from other African countries and sometimes Western world, just to get this done. So it's really, I think we still have a long way to go. Talking about AI being integrated into the health sector in Nigeria, as in terms of robotics, imagine a robot carrying out surgery or trying to administer healthcare to people. I knowing my countrymen and women, that would be a very difficult thing for that robot to achieve here. Because I forward, I can't just imagine myself submitting myself to a robot to, access me, trying to take care of me or administer treatment to me when I'm used to the human touch. So we have a long way to go, and I'm very sure I'm speaking for millions of Nigerians out there. Before we allow any robot to get access to us to take care of us, I think a needle or a cow will have to pass through the needle's eyes before that will happen. But I think it's all a matter of time. As time goes by, when we are given a good reason to accept it, we might we might accept that. That's just how it is. Yeah.
All right. Thank you so much, Patience. This is why I asked Doctor about African practices, because I know that in Africa, some things, they're very different from us, and to familiarize ourselves with them, it's really a struggle. Yeah. And talking of AI, Doctor, what can you say about AI and data? Seeing you are somebody who is passionate about data management, monitoring, and evaluation, I want to think AI is of significance in that department. What's your take on that?
Okay, patience, you raised a very good idea. It seems funny actually, but don't misunderstand the AIs. It's not only the advanced AIs, even ChatGPT is an AI, so we can ask it
Mm,
anything. We can acquire a knowledge or skills from that. The generative AI is in our daily routine. So the robotic one is very advanced one, which seems very far away. But the ChatGPT, which ChatGPT is literally my senior friend. So that's our daily routine. So we can use AI in this way as well. And there are also diagnostic methods. Most of the diagnostic methods nowadays are integrated with artificial intelligence. Cancer is being diagnosed with AI. Imaging technologies are being AIs. So it's going to be very helpful. So AI in data analytics is also crucial. There are different softwares for data analysis. For instance, I want to talk from my experience. I use ChatGPT and other generative AIs for data analysis, which is very practical and which is very routine. So it's very helpful in the data analytics field as well. So it's very helpful.
In fact, Dr. Enku, this is even the part that I'm so curious about your journey. You are a medical doctor, a sound one at that. How were you able to create the time to go into the path of data analysis? Because I know you medical doctors are very busy. Your profession is more like a jealous mistress. So how were you able to pave the way into tech, data analysis, to be precise? And how were you able to leverage on data analysis to improve the healthcare outcome in your country, particularly in the context of HIV care and treatment, which we are actually treating?
Okay, Patience, thank you. It's a very good question. You are right. This is the question I mostly get from other people as well. So, as a medical personnel, data analytics is somewhat different from the medical aspect, but there were challenges that drove me to join this data management system. When I was working as a clinician in the tertiary and the primary care unit, there is a performance monitoring team, and performance monitoring was a routine activity on monthly basis. So there were always challenges with data. We couldn't get data, or if there is, if the data is available, there is always a quality issue. Either it is not consistent. There are different quality issues. So it was a headache. It was always a headache when I was practicing the clinical medicine. So I was always curious, why is it a problem if we have a good data, and having a good data by itself is not helpful. That's the point. You may have the data, but if you don't use that data properly, if you don't analyze it and drive insights from that data, it's just meaningless. So I was always wondering, why would it be always a challenge? The professionals are always scarce. There, we don't have, in Ethiopian context, we don't have many data analysts. Even I can't mention a role model even for the Ethiopian context specifically, but in the outside of Ethiopia, I can mention many experiences data analysts. So I was always curious. So I was passionate to improve that problem, and during this process, I heard about ALX, which is a partner of African Leadership University, if you know that. So I applied for that program, and fortunately, I passed the exam and joined that fellowship. It was given in collaboration with the Explore AI Academy, which is in the Western Cape in South Africa. So I joined that program, and I gathered a very good insight about data. My perspective about data was not the same after that. So I decided to continue on that track and to improve the problem for the healthcare industry. So currently, before some months, I also joined a fellowship program in non-governmental organization in Addis as a data fellow. So that's why I decided to pursue this path. There is a very huge challenge, and I want to be the one person at least. I want to contribute to resolve that challenge.
Okay, that's really laudable, doctor. But I observed you kept mentioning challenges that you faced. Challenges, maybe on the part to use data analysis in terms of maybe using it to inform decision making in healthcare, and even while you are in your because of administering healthcare, especially to HIV patients, you will also experience some challenges from what you've been telling us right from when we started. So I want to ask, what are some of these challenges you faced? in the course of your work, trying to blend healthcare with data analysis, and how were you able to overcome them? Because I'm very sure some other medical experts like you who may want to venture into tech and they may be weary of such challenges in the future. And definitely they want to learn from you how they can overcome it, or them should they come their way tomorrow.
Okay, patients. The challenges are, let's mention some of them. For instance, our national database for healthcare system is DHIS2, the Health Management Information System. We use the tool DHIS2. So we know that the database DHIS2 is there. When I was in a clinical practice, I know that the DHIS2 is available, but I have no idea on how to use that data so that I can't make an informed decision regarding my patients. I can't bring about individual-based treatment based on the patient data because I don't know how to use the data. It's a very huge challenge. The other thing is data by itself helps in resource allocation. Optimized resource allocation derived from data is a very efficient way of performing tasks. So I saw the challenge of resources were allocated in a traditional way. It was not evidence-based. So resources were wasted back in my clinical days. So it was also another challenge. The other is the process was not also streamlined because we don't have a data. We have to work in a traditional way, in a way that was usually being done, which is a usual way, but it doesn't mean that it's the right way. So it was the processes were not streamlined. So that was also another challenge. Mm, the other thing is in my country, the people who are involved in data are health information system professionals. Health professionals by themselves are not involved in the data aspect, but the indicators and other parameters are more understandable to the healthcare professionals. The HIS are not healthcare professionals and they don't have the health background and there were difficulties in communicating. There are sometimes errors in analyzing the data and something like this. So I was thinking if a person has a healthcare background and if he or she adds the analytical aspect to that knowledge, it would be story changing. So I was thinking that way, and the challenges are this lack of professionals is also a major challenge in my country.
I see. See. Now,
Okay.
it would be fine if African policymakers can support the growth of healthcare and technology sectors in countries. That is looking from, or let's draw example from what you've experienced in your country, from what you've experienced traveling to other African countries to carry out or to collaborate on some medical projects that were carried out. And I believe there's a single thread that runs through these countries, just like it is in your own. And if you should come down to Nigeria, or if you should go to Lesotho, you also experience similar thing. You know, there's a single thread that runs through us as Africans. So how do you think our African leaders and policymakers can support the growth?
Patience, it's interrupting. I can't hear you well.
Okay. A question is how can leaders support African countries in terms of data? She wants to know about the leadership, the role that the leadership can play in our countries.
So African leaders in general have a very good influence in the community. So they can influence and they can create awareness on the how necessary utilization of data can be. So they can use their influence and they can advocate for policies that support in adopting such strategies related to data. And in a way, using their influence, they can help. Yeah, being influential by itself is a very crucial point in advocating for policies. And attention, there is also a need for attention. If there is no leadership engagement, that area couldn't develop further. So they can give their attention, they can advocate for policies that support strategies to enhance data utilization and so on. Yeah.
All right, Victor. Meaning it is very imperative for our leaders to be completely engaged in healthcare and in every aspect of healthcare, including data
Yeah,
itself.
definitely.
Okay. And I was a data personnel myself, so I know how difficult it can be to collect data, especially, excuse me, especially in primary healthcare. Any barriers that it can point that account to the data.
So the major barrier is the problem with capacity. As you mentioned, in the primary healthcare, actually, when we go down to the tier, the capacity of the healthcare professionals is not regularly built, so they may not be fully equipped with data utilization, data management in general. So sometimes there is also lack of structured data collection methods. Some may collect a
Mm.
data in a way he or she wants, but the other individual might collect the similar data in a way he or she wants. So it's not very structured. So that's also a challenge. The knowledge and skill gap is
Mm.
also a challenge. So these are the major challenges when we go down to the tier.
All right, indeed. So, in essence, there should be standard guidelines on how to collect data, I
Yes,
think, so that it can guide each and every one of us, so that we have at least unison in terms of what we are collecting, how we are collecting, so that data analysis can be
yes,
easier.
yes,
All right. Um, and data is very important, really, in helping us make informed
yes.
decisions. And I want to go back to AI. Do you think data can be manipulated or can be cheated using AI?
Mm, I believe I am not a AI specialist actually, but I believe AI gathers information from different parts of the world from different individuals, numerous individuals. So those individuals are indirectly feeding that AI an information. So it's indirectly collecting a data to provide us with what we want. So I believe data can be collected through AI, even though I'm not an expert
Okay.
in this area. I believe so.
All right. It can be useful.
Yeah.
Okay. There's this new topic that's really hot. The USAID funds that has been terminated by the President Donald Trump. And seeing that many countries in Africa were supported by the USAID, especially in combating HIV and TB.
Mm,
What do you say about that? What's your role? What can you say about that? The termination of the USAID funds.
You are right. It's very challenging, but it might also be a very good opportunity. So most of these infectious programs are donor based, and the mentorship, from my experience, the mentorship program is totally donor based. If there is no fund, there is no mentorship. So I believe these programs should be transitioned to local ownership. Otherwise, we cannot proceed. So it might be a good opportunity for our leaders to focus on local ownership. We don't we should not always seek for support, grants and donations. At some point we should be able to stand by ourselves. We should use the capacity in the continent. There is a potential. There are many young people in African continent. So we should really look into that and plan on how to use that potential to stand by ourselves. So this is a very challenging time for most of us, but it could also be a very good opportunity to look into ourselves. So that's it.
Very true, doctor. But you're saying, in essence, is we should look at it as a blessing in disguise, an opportunity for Africans to take
Mm-hmm.
initiative of their own healthcare. Yeah, yeah. Okay, that's really very good. Patience, are you winning on your side?
Oh, yeah.
Are you okay?
Okay, apologies. We are having some technical glitches here. So, as you can see, I kept moving in and out of the line. Well, I'm back now. I'm back. I actually wanted to ask Doctor before I was whisked away by the poor network connection. I need to ask you, you are so passionate with what you do. If we're talking about women in STEM, we should mention you. I thought you should be one of the foremost African women to be mentioned because we're doing a very good job functioning in science and technology. So well blending your skills so well for the good of humanity, for the good of your country people, and of course, fellow Africans. So, what advice would you give to young women who are interested in pursuing careers in STEM and healthcare?
Mm. So, as you mentioned, there are many challenges, particularly for women in Africa. So,
Mm.
my advice is to use the challenges as an opportunity. Nowadays, there are affirmative actions for females and women around Africa. I don't know if it works for other African countries as well, but in my country, there is an affirmative action for girls who are joining the university. The entrance point is a little bit lower, and there are many affirmative actions. So we should leverage that opportunity. We should leverage that opportunity. If the opportunity is on the table and we are not going to use it, it's useless. So leverage such opportunities, seek for support. The one challenge for women is societal expectations. Women are usually expected to bear the greater burden of caregiving by the society. So that impacts their progress to their goal and their passion. But seeking for support from family, friends, and even colleagues is a very good idea. Seeking for support doesn't mean that we are weak or something else, but seeking support means that we are passionate to grow. So seek support, use your time effectively.
Mm.
So the time is a limited resource. We should use that effectively. And uh, also look for role models. Of course, what I was mentioning before was that women in this men dominant these are very scarce, and so many young girls need a role model, a woman role model, but they don't have that. So the older ones should work for the younger generation. We should be a good role model, and the younger generation should keep on following that lead. I think by doing such things, and things can be changed.
Hmm.
Mm,
Thank you. Thank you so much. That's a very practical advice.
mm,
And I wish the young women, especially
mm,
in Africa, who listen to what you're saying just now, they can imbibe it in their lives. Time is one of the most limited resources ever that we have. Very good for us to channel it wisely at all given time for something more profitable.
mm,
We will how much money we have, but we can never know how much time we have. So it's very important that women should be, age, or they should be
mm,
intentional about time wisely. This advice is coming at the very right time because 2 or 3 days from now, 2 days away from now, we should be launching ourselves into the Women's Month fully. The month of March being the month dedicated
mm,
mainly to not just the month of March. So safe to say we've already started our Women's Month. We've already started on a very good note, from
mm,
this conversation we are having with you. But I
mm.
still want to ask, I just want to ask one more question, please. At least from my end. Just one more, I promise, one more question from my end. Uh, what are some of the most significant lessons you have learned throughout your career? And how have these lessons shaped your approach to work?
Mm. So the lessons, one is about what I have mentioned, the time. There are many things I now understand. I sometimes feel that I didn't use my time effectively. So this is one lesson. Starting from some years back, I'm trying to use my time effectively. I'm trying to use the resources I have efficiently, because those resources might not be available all the time. So I'm doing that. So this is one lesson. The other lesson I get it being adaptable to different situations, being flexible for different situations, and setting different goals and action items at different times, at time changes. Very important to achieve what we want to achieve. And the other is technology integration. We have already mentioned that technology integration, utilization of technology for our personal and professional development is also a lesson for me. I learned that lesson. The other is networking. Networking is very important. It seems like less important, but it's very, very, very important. Networking to people who are working at different parts of the country, and even out of the country, different parts of the continent, is very crucial. We can share experiences, we can collaborate, we can go together. So networking is one lesson I learned to be very crucial during my journey. These are mainly the lessons I learned.
Hmm. Thank you very much, Doctor. So, particularly for all ladies out there, everyone coming up, young professionals, those who are about to launch themselves into not only the medical field or the tech field, but no matter where you find yourself or what you want to really specialize into, do not joke with networking. From what Dr. Enku has already told us from our own experience, what has really helped her to be the success we are seeing today. Of course, behind every successful story, so many things have gone, behind a lot of things have really gone behind the scenes, what our eyes do not see. It's just like a plant that is growing. You don't know what was going on under the soil. What we see is the fruits coming up. So take your time, network with relevant persons, people relevant to your profession, relevant to your growth. When we say you should go out to network, we're not saying that you should just go and look for people that will assist you to waste your time, assist you to kill your dreams. No, people that will surely add value to your life. And of course, you also add value to theirs because this is a two-way traffic, right?
Hmm.
It's also very important. You take your time and make good use of your time. Your priorities should be set. You set the right priorities. That is one way to achieve whatever you want to achieve, especially when you are joining into STEM. You want to be a woman in STEM, you have to learn how to take good care of yourself and your time. Very
Hmm.
important. So thank you so much. Thank you so much, Dr. Enku, for sharing your inspiring story and valuable insight with us today. Um, Marseille, do you have something that you want to add to this?
Yes, ma'am. Thank you so much. I really commend Dr. Enku for her passion and love in healthcare. Healthcare is one of the most important sectors, yet it is not really given much attention. But every one of us needs a proper healthcare. So we need people like her who have passion, who have compassion, and especially in Africa. In Africa, we are so much underprivileged with many things. We'd rather long distances to get to our health center. We do not have adequate equipment. But people like her who dedicate themselves into the healthcare really make it worthwhile for our African fellow people. So, Doctor, how do we empower the African countries, in terms of healthcare, just as we are about to conclude? I believe your experience has shown you um, some things that you would love to share, empower our African community.
Okay. You have a very good point. So, empowering the African community, when I reflect on my journey in the healthcare, empowering the African community needs different strategies. I have already mentioned some of them. We should communicate. The elites in Africa should communicate well. We don't have to focus on our country only. We should communicate with different professionals, different people in different parts of the continent, and we should be open for adopting strategies at different parts of the continent. The strategy which is proven to be successful at part of the continent might be also helpful in the other part of the continent. So in order to do that, we should keep on communicating. We don't have to just run for the country we live in. We should think as a continent. So the young people is, as we know, the younger population in the world is mostly saturated in Africa. So we have the potential to grow by ourselves. So we should know that. We should know our value. We should communicate. We should network. We should share our experiences in different platforms. It can be through training programs or other collaborations, and we should do that, I think, and we should be open for strategies to adopt different strategies and approach to some parts of Africa from other parts. So it's important. And the regional integration, of course, it requires leadership and the political commitment, but regional integration will also help us to achieve most of the SDGs if we can work hand in hand we can achieve most of the goals we wish to achieve. So we should collaborate. Collaboration is very crucial for the African community, and the community should be engaged in the problem. Community engagement and social behavioral communication is very crucial. So community engagement, SPCC, collaboration, and experience sharings are very important, I believe.
Wow, thank you so much, Doctor. This was very insightful.
Thank you.
Patients had a great
Yeah,
time.
I agree with you, Doctor. I really agree with you. Collaboration is the new competition, indeed. Some say competition is good, especially when it's about business. But yeah, it is good, but collaboration is better. So when we collaborate as Africans, we should have it more in mind that we are Africans. Um, we all are. No one can be more Ethiopian than you amongst the three of us. But you still not be more African than us. We are all Africans on same plane. So we should think more towards that end. After all, like I said before, in the long run, there's a common thread that runs through us, right through all of us. So we have that African mindset, collaboration will be very easy. And when we collaborate, definitely the success rate will be huge. And there's so many hurdles we are yet to, you know, cross, to jump over in the medical field when it comes to healthcare here in Africa. The only way we can truly gain success is by collaborating. So thank you very much for bringing out that very crucial point. And I believe that everyone streaming in right now with us will have that in mind, especially to those who may be concerned, those who are policy makers in particular, wherever they are in Africa. Please, collaboration is the new competition. Let's focus more on collaborating. And the more we collaborate, we can better synergize and get so many things done, so many wonderful things that will surely launch us, thereby taking Africa to the world and bringing the world to Africa. You so really
Exactly.
appreciate you, Dr. Enku. Your work is a testament to the power of technology in improving healthcare outcomes in Africa. So, people out there, our viewers, who we so much esteem, we thank you too for today's episode with Dr. Enku. And I'm very sure you enjoyed your time with her, just as I and Marcia Bata also did. You can see that we were just carried away, like we were carried away, but we have to be time conscious because we promise you that it's going to be for just 3,600 seconds. So we can't really exceed that. All the same, we thank you for joining us on this episode. If you have more questions, Dr. Enku is on LinkedIn. Of course, like you know, she's on LinkedIn. That's why we are here on LinkedIn Live. So feel free, approach her. And for Africans across the continent in the medical field, for those of you who are operating medical NGOs, feel free to collaborate and let's see how we can help ourselves take care of and also reduce the rate of HIV in Nigeria. HIV/AIDS is, please, it is real. People should not think it is a white man's disease or some conspiracy theory. It is real. Let us spread this message and not the virus. Okay, so you can collaborate with Dr. Enku. I'm very sure she'll be glad to see how she can bring her expertise and see how they can also integrate technology to healthcare in your various countries across Africa. We hope you found this conversation is informative and inspiring, and of course, insightful like we did right here. Do not forget to follow us for more provoking conversation, thought-provoking one at that, with other industry leaders. And we're about to launch into the Women's Month, like I said. Ladies in Africa, please rise up and make a difference in your generation. And watch out for the Women's Month because more African women will be coming right here to share their experience and insight with us. Thank you. We hope to see you all next time. Once more, thank you, Dr. Enku. We
Thank you
enjoyed
so
you.
much. Thank you for having me. I appreciate your initiative. Thank you.
Thank you so much.
Thank you so much.
So,
Bye.
from Dr. Enku, from Marcia Bata, and I, we say goodbye.
Goodbye.
Bye.